William Green is a 65-year-old African-American man with 3 grown children. For 15 years, he worked on the loading dock at the local Walmart, but was laid off after suffering a non-work-related back injury. Eventually, he found work as a security guard at a bank, but he currently has no health insurance. 1 year ago, Mr. Green noticed blood in his urine, but initially he was too embarrassed to mention the problem to anyone. After a few weeks, he began to feel pain on urination and went to the emergency room. At the emergency room, Mr. Green received a hurried examination and was given a prescription for antibiotics. After a week on the antibiotics, he returned to the ER since there had been no change in his symptoms. At the emergency room, he received a prescription for a second type of antibiotic. Once again, Mr. Green saw no improvement in his condition and returned to the ER. A third doctor suggested that he undergo a cystoscopy. It took Mr. Green 2 months to save up the $750 for the procedure, which revealed cancerous cells, and subsequent work has revealed bladder cancer. Today, Mr. Green will meet with an oncologist who would like to enroll him in a clinical trial to study the effects of a new cancer drug used in combination with the current standard 2-drug treatment combination.
Mr. Green, unfortunately with the late diagnosis that you have, it has limited our options for how we can treat this. But what I can offer you is we do have a clinical trial that we've just begun that I'm researching at this point, where we have a 3-drug therapy. I really believe this would be your best option at this point.
Wait a minute, don't you have anything positive to tell me? I mean...
I'm sorry, unfortunately at this point, we're not looking that this is something that could be curable, but what we can do is hopefully arrest its development.
Doc, I've been through hell. This thing started a year ago. I scared the death out of me with blood coming out of my urine.
I've realized
too embarrassed to talk to my wife about it.
Unfortunately, with the delay that you had in seeking treatment.
I went to the emergency room 3 separate occasions. The first time I stayed there 2 hours and waited for a doctor who spent less than 10 minutes with me. Took a urine sample and sent me on my way. It was like I wasn't even there. A week later, I'm still bleeding. I go back to the emergency room. I wait another 2 hours. The doctor doesn't stay as long as the first one.
I understand. I have read.
Tell me this, doctor.
Mr. Green, I have read your chart.
I go back a 3rd time, then they tell me I gotta have some cystoscopy or whatever the thing is.
Cystoscopy.
Why can't I have the surgery?
At this point, the surgery would not be something that would be beneficial to you. This clinical trial that I am doing now, we are hoping to look at a 3-drug therapy that will address the problem from another angle. Normally we do only a 2-drug therapy. That's what's standard now. But we're hoping that this 3rd drug therapy will come at it from a different angle, and that although we can't cure the cancer at this point, we could prolong your life, arrest its development a bit.
Prolong my life?
Yes.
What are you telling me? I can't have the surgery, so what are my chances without the surgery?
On average, with the standard 2-drug therapy at this point, we're looking at 9 months. But what I would like you to take a look at is this information I have on the clinical trial that we are starting. Now, the one thing that we do need to be aware of is whether or not you are diabetic. Do you have any history of diabetes in your family, or do you know that you are diabetic yourself?
No, I don't. No.
Okay. That would be our first step, that we would have you tested for diabetes. If you are diabetic, that would eliminate you from the possibility of joining this trial. But that's where we would like to start. So what I would like to do is set up an appointment with my nurse out in the waiting area so that we can start this right away, get you in the loop, and get you started here.
I got to talk to my kids about this. I mean...
Mr. Green, obviously you're aware that time is of the essence.
Yeah, I know, and I know you don't have a lot of time. I know you're a big man, and I see all the people following you around. You're very important, but